Our team coverage continues right now, and it includes a story we've been following very closely. Local organizations that help people with disabilities have filed a federal discrimination complaint in Washington, D.C. Channel 3 Eyewitness News reporter Courtney Zeller is joining us live right now with all these new developments on the compassionate visitors policy. Courtney, what are you learning?
Hi, Mark. Well, I can tell you a number of organizations that help people with disabilities have been fighting for this for about a month now, trying to get state agencies to come up with this policy. Well, last week, those state agencies did, but it was just a recommendation. And after numerous people with disabilities have been hospitalized, for some, it become a family's worst nightmare. So now these local organizations are taking it one step further. You're looking at a 12-page complaint filed by Disability Rights Connecticut and other advocacy organizations in Connecticut. They're calling on the federal government to investigate our state's Department of Public Health.
I still don't understand why the state has not taken action.
Last week, Connecticut came up with a policy that will strongly recommend and work with hospitals to allow one support person to accompany an individual served by DDS, or Department of Developmental Services. But organizations say it's not good enough because every hospital has their own policies and can refuse visitors. They've asked for revisions to the policy, but state agencies haven't responded.
If you don't have a disability, you don't understand what it might be like to be totally isolated, to not be able to see, to not be able to hear, or to not be able to understand what's happening around you.
The complaint shares the stories of 3 patients who went to different hospitals for help. Organizations say not allowing a patient support person to be present during hospitalization jeopardizes their quality of care. That includes Shane Sessa, who has cerebral palsy and limited communication. We talked to his mother last week. He was admitted for stomach pains, but was monitored for COVID-19. His test turned out negative. In the complaint, it says Shane is still upset and shaken from the experience. Shane sometimes makes the sound of an ambulance siren to communicate his concern of being taken to the hospital and to receive assurances that he is not going back. The complaint is now in the hands of the Office for Civil Rights of the U.S. Department of Health and Human Services in Washington, D.C. The office gives Connecticut funds to pay for health care for those with disabilities.
Significant amount of resources, and it affects our most vulnerable. And they have a true stake in making sure that their money is not used in a way that discriminates against people with disabilities.
And we are also learning tonight 17 Connecticut state senators are backing the organizations that help those with disabilities. Policies are already in place. You know about New York, New Jersey, also new Oregon, Illinois, and California. Now, I did reach out to the Department of Public Health and DDS. Both say because this is a legal matter now, they can't comment. We're live at the mobile newsroom tonight. Courtney Zeller, Channel 3 Eyewitness News.